Hello, I'm back for Carline Talk. I wanted to talk about chronic and what the definition of chronic is. I know that I say that the metabolic conditions or lifestyle conditions, I don't like to call them chronic. I have several videos on it. I like to call them curable. Chronic has this connotation kind of in English language. It's going to be persistent and lifelong. The definition doesn't say lifelong, but when you say something is chronic, you mean it's going on forever and on and on and on. So when we use chronic in healthcare, there's actually two different ways we use it depending on what we're talking about. When we're talking about guidelines, like the American Diabetes Guidelines, NIH, AHA, any of those types of guidelines that are talking about something being chronic. So those are also the research definition. Chronic means last at least 3 months. So 3 months for that. And then when we say a chronic condition and we're talking about somebody who has Medicare. So Medicare is very specific on the definition of chronic or a chronic condition. They say in order to be a chronic condition, it has to last at least 12 months or until the patient dies, and it has to have a very large effect on their life and can lead to severe functional decline. Chronic, when we're using it in everyday language, like I said, has this idea that it's going to go on and on and on and on. And again, when we're talking about chronic from a guideline perspective or research perspective, 3 or more months, and Medicare, 12 or more months until death. When I'm talking chronic and I say I don't like to call the metabolic conditions chronic, I like to call them curable. I guess it's very nuanced on what definition. I'm talking about just the English language definition of chronic. I think it's a better idea to let somebody know that is getting diagnosed with one of these conditions. It is, in most cases, reversible. There are instances where it's not. I understand that. There are genetic issues that can cause something to last forever. There are trauma issues, injury. There are situations where maybe a metabolic condition was let go too long. Somebody's had a stroke or a heart attack and there's now permanent damage. Or the metabolic condition, whichever it may be, has gone on so long that there's just, they haven't necessarily had a stroke or heart attack, but there's other permanent damage that has been done. That would then be something that would last forever. So if it is bothering people that I say chronic is not what I like to call these things because I feel like they're curable, I could be more specific in that. These conditions do not need to persist forever in most cases, and people should be given the tools, if they want them, the tools other than the prescription medication, or maybe they need to be using prescription medication as a bridge, whatever that may be. They need to be offered all of the possible resources to heal themselves the way that they would prefer. I am here, though, to educate to whoever wants to hear or whoever wants help on how you can do it without necessarily needing prescription medications forever. I have a huge passion in that because I have worked with people in these situations for years. I'm not coming with any hate. I'm not coming to argue or anything like that. If you don't like how I say most chronic conditions are curable, when I'm talking about chronic, I'm talking about metabolic conditions, lifestyle conditions, then, I apologize, but this is what I'm saying. And if you don't want to hear from me, I've heard a lot of, you're a pharmacist, this isn't what you know, which could be for another video, but just quickly, pharmacists know a lot about physiology. That's what we learn when we get our doctorate. Physicians do a lot of anatomy and physiology. Pharmacists have to know physiology very well because when you take a prescription medication or even a supplement, which we also learn lots about, or over the counter, that is working somewhere inside your body on a receptor, in a reaction, etc. That's your physiology. So we know physiology in and out. When we know physiology in and out, we know where prescription medications are supposed to work. We know how things are supposed to work without the prescription medication, what the prescription medication is doing. So I would say we are in an expert we are an expert or in a great position to educate somebody on how to fix that without the prescription medication. But if you'd like to hear it from a doctor, there's a wonderful doctor, Dr. William Li. There's others too, but he has a great book and a lot of YouTubes if you would prefer that. But his name is Dr. William Li. One of his books is called Eat to Beat Disease, but he talks a lot about chronic conditions being more curable. If you don't want to hear from me, there are some physicians as well. If you're just happy, that is totally fine too. That's all I want, is people to feel well, feel their best, and whatever way they need to get there, that's totally fine by me. Have a wonderful day.